Welcome to TMJ Unlocked, the podcast that goes and dives deep into what's going on with your jaw joint, headaches, migraines, myofascial therapy, and all these fun things that have to do with your head and all of this going on up here. It's really, really, really good. So thanks for joining us. I'm Dr. Gunnarsson, and this is Mindy. Just a brief recap of our last discussion that we had. We talked about the jaw joint and what clicking and popping, what that meant, and is it a good thing to click and pop or a bad thing, and what happens when it stops clicking and popping. What am I doing now? What's going on with my jaw joint? So we covered all that last time. So if you missed that podcast, go back, listen to it. It's very informative. We had a great discussion. This time we'd like to dive a little bit deeper into the TMJ, the jaw joint, and how it deals with migraines, headaches, what relationship it may have with that. And I get a lot of patients who come into the office. That's part of one of the things that is bothering them. It's not just pain in the jaw, but headaches. And these people will have chronic headaches. Sometimes they'll wake up every morning with a headache. And it's interesting. I had a lady come in the other day and she said, we asked them, because we go over your progress each time you come in, and we asked her and said, how are things going with your migraines or headaches? Because that's one of the things that you listed as one of the things you wanted us to help you with. And she says, I have not had a headache since we started treatment. And right there, it's just a testimony that we know how much that TMJ plays such a big part of what goes on in and around our head and the muscles and everything goes on there.
So there's actually like 400 or so
400 different types
of headaches.
Yeah.
But the most common headaches that people experience are going to be your tension headaches or your migraines, which I've never personally had a migraine before, but I know people who have, and it really puts them out for quite a while. They even have to cancel work with these terrible headaches.
Mild to just totally debilitating.
Totally debilitating.
Yeah, turn off all the lights, shut the windows, and lay in bed.
Exactly. There's also cluster headaches and cervical cranial headaches kind of. So these are the most common types of headaches that happen. But like we mentioned, there are over 400 different types. Oftentimes, these headaches are treated just in isolation, like, oh, I have a headache, I'm going to treat my headache, without realizing that there could be more of an underlying cause for it. Like with a lot of things with our body, I mean, everything's connected. So when you're having a headache, we really need to find what that root cause is. And a lot of times, these symptoms overlap with the temporomandibular joint.
Yeah.
And
so before we go in too much deeper, I have my skull here, and I'm going to go over the anatomy of this joint and how that joint works. Going over some of the anatomy of the jaw joint, we have the mandible. This is your jawbone down here, and it comes up into here. This is called the condyle, up into here that comes into the joint space. And this is your temporal bone. And that's why this is called the TMJ. It's the temporal mandibular jaw joint. That's TMJ. And what this does is it is one of the most complicated joints in the human body. We know that in every joint, there's cushioning between bone to bone. So bones aren't on each other. Otherwise, we call that arthritis. And so when there's cushioning between this jaw joint, everyone thinks that it opens like this. And that's all we do, is that we open like this. And that's called a hinge. And of course, our jaw joint does hinge like that, but it also does something called a glide. And I can't do that on this model because this is set in place right here. But what happens is it actually slides forward with this joint space coming with it and the disc coming with it and then sliding back and then coming forward and then coming back. Because there's a disc right in between here, between the condyle and up here in the temporal bone. There's a disc that protects those bones from coming in contact with each other. So it's interesting how not just in that anatomy where it's all muscles and tension. I mean, you saw where the jaw joint affects the temporomandibular area right up in here, and in this muscle right up in here when you clench and grind your teeth, how much effect it has over in the referred pain that can be all through this whole side of your face. And we see that all that time, that forehead, the neck, the back of the neck, even trigeminal nerve pain and referred pain, because when you get inflammation in tight muscles in certain areas, when you have nerves running through those nerves now get pinched, get tied up, and you can have headaches, migraines, that sort of thing, just from having those pinched nerves. So how this all puts kind of together. How does that? I kind of went over those muscles and the tension in the muscles and how that has effect, but constant clenching. And I get people who come into the office and they say, I clench all day long. Oh, I know I clench. And it surprises me because it's like, I can't believe someone clenches all day long like that.
Right.
But that equals muscle fatigue, and that muscle fatigue equals pain. So that's just one way, is that constant clenching, especially at night. And if you're waking up with morning headaches, it could be because you're clenching all night long. Misaligned bite puts pressure on the jaw joint, nerves. Limited movement, tension buildup. Inflammation plus that neurosensitization over time, like I was talking about. You get that inflammation, all these different areas, and that neural stimulation. And it just that like gets that buildup, and then you're having these chronic headaches and migraines. And Mindy talked to us about poor posture. How does this posture have to do with it? We're seeing more and more these days, kids always
Screen
looking down at
time.
your cell phones and the screen time.
Their hand, it's either in their lap and they're hunched over like this, or it's in their hand and their head is down, or they're typing on a keyboard and their monitors are too low. These students that maybe aren't necessarily gaming on their phone, but they're doing work, and also workload of adults too. So, I mean, posture really plays a big role, and the screen time that's involved in there in making headaches worse.
I do get honest people who come in and talk to me, and they will say, I hunch over a computer all day long, which is a good screening point for us to sit down and talk about, well, what if we were to change that, just that, would that affect your jaw joint? Would that affect your headaches?
So some of the symptoms to watch for are morning headaches. If you're waking up with a headache in the morning, oftentimes that's likely because you've been clenching and grinding at night without even really realizing it. And that clenching and grinding is often related to dysfunctional airway or airflow while you're sleeping. We can get into, I think we've had a podcast on sleeping and the TMJ joint in the past. So go ahead and look at that and see how poor airway, but that can also affect the headache that's going on. You want to watch for temple pain or pressure in this area. That's one of the things that can also indicate that you've been clenching or grinding, because that's an area where those muscles attach, those clenching muscles attach to. If you're having sinus pressure but no congestion, that's something to look out for that could be related. And then earaches and dizziness. That TMJ joint is so close to the ear canal that if you're having ear aches, or even where you feel like your ears are plugged, but you know that they're clean from wax and things like that, that plugged feeling can be related to pressure in the jaw joint from the jaw and dysfunction that's happening with the muscles in that area. Jaw fatigue. Obviously, if you work your muscles too much, you're going to get fatigued. And so you're going to feel that kind of fatigue, tiredness in your jaw, clicking, and even tightness. So if you have any of those things going on, those are some of the symptoms to watch for, that you may be having some dysfunction. If it hasn't led to headaches, or could be the source of what your headaches are if you're experiencing headaches already. Now, of course, the light sensitivity is a big precursor for migraines that are coming on. So definitely watch out for those. Even stiff neck, like when you wake up in the morning, I must have slept funny. I had this kink in my neck. Oftentimes it's related to that constant pressure, the clenching, that grinding, these silent triggers that are happening. And then, of course, if you have limited opening, we know that you have a TMJ issue, as described in the previous podcast, called being locked closed. And all of those are things to watch for.
So let's talk about then things that can be done to help us, right? What are the steps in the diagnosis? So let's first talk about some things that are going on that I see when people are coming in. Patients who have gone in and had a CT or an MRI that shows absolutely nothing. And then their doctor has dismissed that as just stress. You just have stress. And that's why you're having these headaches. And then frequently we see patients who are put on medications. And we know that medications, more and more people want to get off as many medications as they possibly can. We're seeing that more and more in society where people don't want to be dependent on medications because medications are really just a Band-Aid. All they do is they mask a symptom. And so one thing that I see also is when I get a patient who comes in And it's just they're worn out because they have bounced between so many different doctors and physicians. They've gone from a neurologist to an ENT to a dentist, back to a neurologist, back to their regular doctor. And they just get bounced back and forth between everyone trying to figure out why they're getting these headaches and these migraines. And so that can happen too. Overuse of pain relievers. Tylenol and Advil can really wreak havoc on the body when taken on a regular basis for daily. And it really, again, masks that root cause so that when it comes to diagnosis, it's harder to diagnose. And the missing piece, the function and evaluation of the jaw joint. Frequently, people come to me because they've seen a podcast, a posting, or they've seen our website that talks about headaches and jaw pain, and they have nowhere else to go. Now that they were referred, they just happened to find us. And I think that's kind of sad because jaw joint plays so much into those muscles and the muscles of the head and can be a cause of so many different headaches.
So once it's been diagnosed, maybe what a root cause is, if it happens to be dysfunction in the head, neck, jaw area, there's definitely things that we can do to help alleviate these migraines that have been happening, just like the stories Dr. Gunnarsson has shared with actual patients that have come into our office and gotten relief from their headaches. Myofunctional therapy is a great way to help get that muscles in balance. We talk about stress therapy, helping people find ways to relieve stress. We work with better breathing because oftentimes, as mentioned, breathing in that airway resistance is leading to the clenching at night anyway. And when we can work through the root cause of what's causing these headaches, then we can start to find some relief. And the tongue positioning, where your tongue is resting, plays a big role on strain that could be happening or relaxing if it's in correct position of muscles because things are working in function. And so those are the things we like to evaluate on the myofunctional therapy side of things. What are some things that you'll do that'll actually help to fix this problem?
So if we find and discover that the jaw joint is contributing to all of this, we can do orthodontic appliances that help you disclude the bite, open up that area up in the jaw joint, and help that heal, get rid of the inflammation, help the muscles heal. That's one way of doing it. And I do get people who come to me, well, when I start talking about orthodontic appliances, they'll say, well, I've had an appliance, and I'll ask them where do they get it from, and they find out that they got it off of Amazon. So we're talking about a custom appliance, something that is designed specifically for you and is part of a bigger treatment plan.
It's not a bite guard.
No. Definitely something that is often frequently overlooked is sleep quality. Frequently doctors aren't sending people home for a sleep analysis or a sleep test and a home sleep study and aren't bringing up sleep as part of one of the causes. And to me, it just makes sense that you would test out sleep first before you put people on medication to see if it has any play in it. Because let's get to the root cause again and fix the root cause. Let's just not band-aid things.
Yeah, stress management is a big thing as well, that both sides of, the TMJ sleep side and the myofunctional therapy side work on to help manage stress, because stress is a big leading cause to muscle tension, which leads to this domino effect of then affecting the jaw or affecting the airway, different things like that. And then, of course, we do screening in our dental practice here at the practice that we're working at, Gunnarsson Dental, TMJ, and Sleep Therapy, for people who are coming in just to get their teeth cleaned, and we ask them questions about their sleep quality, their headaches, and things like that, because our goal is to get people to total wellness, not just to treat symptoms.
And if your dentist isn't asking the questions, ask the questions from your dentist and find out what they can do or which direction they can send you to. So, thank you for joining us. This has been a great session on the TMJ and headaches and how those affect each other and are joined together. If you have found this podcast interesting, as information that has helped you or changed you in any way, like us, follow us, and definitely share it with a friend who may be having these problems. Especially if you see them tired, dark circles under their eyes. They have some hidden problem going on with sleep, headaches, migraines, something all involved in that. And they need to get in and see a doctor. So join us next time as we cover more TMJ and airway and focus and myofunctional therapy, all these things that are changing people's lives.